Fuchs dystrophy is disease pathology of the cornea, which is the most outer part of the eye. I like to call it the window of the eye. And the cornea has different layers. Fuchs tends to affect the innermost layer of the cornea called the endothelial layer, where there's cells that help to pump out water and keep that cornea clear. In patients that have Fuchs dystrophy, you sometimes don't have enough of those pumper cells left, and so the cornea will tend to swell, which can cause a decrease in vision, can cause symptoms like glare and irritation to the eye as well. Treatment for Fuchs dystrophy, initially we may start with eye drops such as hypertonic saline or Mira drops and ointment that help to keep the cornea compact and prevent it from swelling. Once the Fuchs progresses where the Mira drops are no longer working, then we do a partial thickness corneal transplant where we will scrape away bad cells and replace them with a very thin piece of donor tissue. Symptoms of Fuchs dystrophy can be blurry vision, especially upon waking up in the morning, worsening glare, especially with nighttime driving. As the Fuchs progresses, there can be more irritation to the eye. You can form pockets of fluid in the cornea called bullae, which can then sometimes rupture and create a lot of pain in the eye as well. Fuchs dystrophy is something that typically does progress. Our main goal is to make sure that your vision is appropriate enough for you to do the quality of life. And when the vision does decrease, that it significantly bothers you, we will recommend corneal transplant to fix the Fuchs. For partial thickness transplants, such as a DSEC or DMEC, the outcomes are very great. The 5-year survival rate for these grafts is over 98%, and most of these grafts can last over 10 years. And so for many patients, it's a great solution to really regain vision and improve their Fuchs. Fuchs can develop. Usually there is a genetic component to it, and so you may have a family history. Either siblings or parents may have needed a corneal transplant or have been diagnosed with Fuchs. Other things that can cause Fuchs include having multiple intraocular surgeries, as well as multiple procedures inside the eye, which can cause a loss of those endothelial cells.